Welcome to your last video in your Chapter 11 video lecture series. It's been a long road, but we've made it here to section 11.9, where we're going to talk about muscles of the pelvic girdle and lower limb. So just like we did with the upper limb, we are going to organize our muscles, starting with the thigh. And this is a cross-section of the thigh here, and we can see that these muscles are bound by a fascia lata. This is a deep fascia, and it's going to help to partition these into compartments. So we have these deeper septa that are assisting us in doing that. Our anterior compartment muscles are going to help to extend the knee or flex the thigh. Our medial compartment muscles are going to help to adduct the thigh. We do have two gluteal muscles that we'll see in the thigh. On the lateral side that are going to help to abduct the thigh as well, abduct the thigh just by itself. And then we'll have our posterior compartment muscles that will mostly flex the knee and extend our thigh. And we'll start out with our anterior thigh muscles with our psoas major, and we also see psoas minor over here, and iliacus, which is found here. Together, they are known as iliopsoas. Again, the P is silent. And it's going to run from this lumbar vertebrae and the ilium over to the femur. It inserts into that lesser trochanter here. And when it contracts, it's going to flex the hip joint. Basically, it'll cause the vertebral column to flex, so you'll bend down. And our muscles on our lateral thigh, which you can see pictured in this lateral view here, you will see the tensor fascia lata. This is attaching to this iliotibial tract, or IT band as it's known, which is a lateral thickening of the fascia lata. And this muscle is going to abduct and medially rotate the thigh. Now let's talk about some of the muscles in our medial compartment thigh. We'll return back to anterior in just a moment. So here we see our adductor longus muscle. We do have an adductor brevis that is found deep to this, so you can see just a little sliver of it over here. We also have the gracilis muscle and pectineus muscle here. They are all going to adduct and flex the thigh. We also have this really large muscle known as adductor magnus, and its adductor part is going to adduct and flex the thigh. But its extensor part, which is found more medial over here, is going to extend and laterally rotate the thigh. And then we have another special muscle, which you can't really see in this view. So here is a posterior view of our pelvic girdle and the femur. And you can see this obturator externus that is attaching to this obturator membrane that would be found here at the obturator foramen and extending over to the femur. This muscle is going to cause lateral rotation of the thigh. Now let's look at the posterior thigh in the gluteal region. First, we have the gluteus maximus, which has been cut in order for you to see some deeper muscles, but this gluteus maximus is going to be the agonist of thigh extension and can also laterally rotate our thigh. Deep to it, we have our gluteus medius, which has also been cut so that you can see the deeper gluteus minimus. And these two muscles are going to do the same thing. They will abduct and medially rotate the thigh. Now below here we have our hamstrings, and I'm going to pull up a picture of that as well. There we go, and in this figure we can see a better view of that gluteus maximus. So you can see if that gluteus maximus is cut out of the way, we can see the origin of these hamstrings from the ischial tuberosity. We're going to have three muscles make up the hamstrings. Our biceps femoris, which is going to be found laterally, and our semimembranosus and semitendinosus. These are going to work to extend the thigh and flex the knee, and we're going to see them more distinctively in a slide coming up. Now for our deep muscles here, to those gluteal muscles, we have our piriformis, superior gemellus, obturator internus, and you can see the muscle belly here covering that obturator membrane as well, but on the opposite side of obturator externus. Our inferior gemellus and quadratus femoris here. All of these are going to work to laterally rotate the thigh. Let's do a clinical view here on some thigh muscle injuries. When someone has a groin strain or a groin pull or pulled groin, they're talking about a tearing, stretching, or straining of proximal attachments in medial muscles of the thigh. Most commonly would be the adductor longus muscle. And typically this takes place if that muscle contracts too suddenly or too forcefully all of a sudden. For example, when they're jumping, kicking, or doing some type of change of direction while they're running. And you may have heard of a strained or pulled hamstring too. My brother battled this actually. It's when our hamstring tendons are avulsed or torn away during quick start and stops or fast running, sudden lateral or medial stress to the knee joint. And you can even see in this person over here, they've got bruising in that area. And you can do some prevention of this by doing a dynamic warm-up prior to any exercise or static stretching after exercise. Now let's move back into that anterior compartment of the thigh so that we can talk about our quadriceps femoris group. This is going to be a composite group of 4 heads of muscles. The fourth one we can't see because it's deep to this rectus femoris muscle. It is made up of rectus femoris, our vastus lateralis, vastus medialis, and vastus intermedius, which we'll see in the next slide. These are going to be agonists of knee extension, and they're going to pull on the quadriceps tendon, which after it passes through, not through, but around the patella here, making it a sesamoid bone, it becomes the patellar ligament and will insert onto that tibial tuberosity. And then before we see some other illustrations of these quadriceps muscles, let's also talk about sartorius over here. It is going to flex and laterally rotate the thigh, and it also flexes and medially rotates the leg. So here is that more specific view of the quadriceps femoris muscles. Here's rectus femoris. You could see that it crosses 2 joints, so it is also going to have a function here at the hip. It will flex the hip. And then the rest are going to extend the knee. So here's vastus lateralis. We've got the vastus intermedius, which we couldn't see in our other view. Remember, vastus intermedius is deep to the rectus femoris muscle. And then we have vastus medialis. And of course, here's sartorius that we spoke about as well. Now moving back into that medial compartment of the thigh, we've got gracilis over here. This is a posterior view. Gracilis is going to flex the leg and also adduct the thigh. And then we have our hamstring muscles in the posterior compartment, again made up of 3 muscles. Here's our biceps femoris that has 2 heads, a long head and a short head. It's going to flex the leg, and it also laterally rotates the leg when it's flexed. It's really the short head that is doing that action. And we have our semimembranosus and semitendinosus muscles that are going to medially rotate the leg when the leg is flexed. Several leg muscles that are distally located are going to span the knee and flex the leg, and that's going to be discussed in the next section. Here is a different figure on those hamstring muscles, and we can also see a better view of adductor magnus. So here's your semitendinosus muscle sitting next to your biceps femoris long head. Here's semimembranosus, and we could see that beautiful membrane that it has, and the short head of our biceps femoris. So I will say that these sit a little bit more superficial, whereas these are a little bit more deep. And then from a medial compartment is our adductor magnus, but you can see the full span here in this posterior view. Here is that adductor part. If I were to kind of draw a triangle around here, that's going to flex and adduct the thigh. And then here's the extensor part that is going to allow for extension of the thigh. Now let's move into the leg. These are known as crural muscles, and they're going to work to move the ankle, foot, and toes. And they are partitioned into an anterior compartment, which is found just lateral to the tibia. and then we have a lateral compartment and a posterior compartment. Let's start with the anterior compartment first. This is in a little bit different order, so I'm going to switch it. Okay, this looks better. So first we'll start off with our tibialis anterior muscle. This is going to be our primary dorsiflexor of the foot, and it also inverts the foot. So you are going to look at your foot and dorsiflex and invert at the same time, and you will get this tendon of tibialis anterior to pop up. Next, we have your extensor hallucis longus muscle. You can't see the muscle belly in this view because it is covered by tibialis anterior and extensor digitorum longus. But this muscle, just from its name, we're going to know that it's going to extend the big toe. And it can also dorsiflex the foot, but it's not going to be a strong dorsiflexor like tibialis anterior. Next, we have extensor digitorum longus. This, if you didn't gather from its name, digitorum, is going to go to toes 2 through 5. So we are going to have extension of those toes. And once again, we'll have some dorsiflexion, but it's more of a weak dorsiflexion. And then we have fibularis tertius. That's going to be that 5th tendon that you count. You can see it over here. And this is going to dorsiflex and weakly evert the foot. We'll see stronger everters in our fibularis longus and fibularis brevis muscles, which we'll talk about in a minute. But in this view, we also need to take a look at this extensor retinaculum. We kind of have that same rectangle look over here, but this is almost like a Y shape over here in the bottom retinaculum. And once again, this is going to be a thickening of fascia in our ankle this time that's going to hold those tendons close to our bones. And here are those individual views of tibialis anterior. We could see extensor digitorum longus with that 5th tendon of fibularis tertius here going to that 5th metacarpal instead of down toward the toes. And extensor hallucis longus, we can now see that beautiful muscle belly and the tendon headed toward the toe, the big toe I should say. Now let's talk about that lateral compartment. Both of these muscles are going to be those powerful everters, and they will be weak plantar flexors just because of the line of pull of their tendons here. So first we have fibularis longus, and this is actually going to have its tendon continue under the foot, so the plantar surface of the foot, and inserts on the medial side of the foot. But when we contract, we are still going to cause eversion of the foot. Then we have your fibularis brevis that is deep to fibularis longus. And if you follow its tendon, we see that it's going to attach right here at the 5th metatarsal. And here's a nice view of that fibularis tertius. You can follow its tendon and see its insertion on that 5th metatarsal as well. And here are those individual views of fibularis longus and fibularis brevis. And I really like this view that they provided because it shows you an inferior view, or that plantar surface of the foot, where that tendon is continuing and attaching to that medial side of the foot at the 1st metacarpal. And now for our posterior compartment of the leg, we have 2 layers here. We'll start off with the superficial layer and then talk about the deep layer. So here's our gastrocnemius muscle. It has 2 bellies, hence the name gastro in its name, a lateral head and a medial head to form the calf. And this muscle is going to help to flex the leg and plantar flexes the foot. The muscle bellies here originate at the femur on those medial and lateral condyles, so we are crossing the knee joint, but its primary function is going to be plantar flexion of the foot. Now deep to gastrocnemius, we could see part of soleus over here. This is a broad muscle that is deep to gastrocnemius, and in our lab videos I'll describe how this was named after a solefish fish, which is a very flat fish. And this muscle is going to plantar flex the foot as well. Together, gastrocnemius and soleus are known as tricepsurae. They are attaching to the calcaneus bone with this calcaneal tendon And we also have this teeny tiny muscle, plantaris, which is going to be a weak leg flexor and plantar flexor of the foot. 1/5 of this muscle is actual muscle belly, and the rest of the 4/5 is just a tendon. So it would extend on down into this calcaneal tendon as well. Now let's move into the deep layer. We will start off discussing the flexor digitorum longus, which is right over here. This is going to, from its name we know, flex toes 2 through 5, and this is going to take place at that metatarsophalangeal joint and pip and dip. We have our flexor hallucis longus, and we know from the name it's going to flex the great toe and flex the foot. And lastly, in here we can see tibialis posterior, which is going to plantar flex and evert the foot. Now if we look at the back of the knee, we also see this small muscle here known as popliteus. This is going to flex the leg and medially rotate the tibia. But because we're not crossing down here, we're not going to have any action taking place at the ankle or the foot. And here are those individual illustrations of these muscles. Tibialis posterior, we have the flexor digitorum longus going to all the toes, and flexor hallucis longus going to the big toe. Little clinical view here on shin splints and compartment syndrome. When you get shin splints, you are experiencing soreness along the length of the tibia right over here. This is another type of issue that we won't talk about. So it's only really in this region over here. This often occurs in new, poorly conditioned runners. So maybe you haven't ran in a while and you're like, I'm going to run 2 miles or 3 miles, and you go out for a run, and then the next day you have shin splints. It may be considered a type of compartment syndrome. So let's talk about what compartment syndrome is. We discussed how in our limbs we have these different compartments that get created from intramuscular septa. And so sometimes we can experience a compression of blood vessels within a limb compartment, and that would be due to inflammation and swelling secondary to a strain or trauma. And what we see is increased pressure in the compartment since that deep fascia can't stretch. And so in severe cases, they have to go in and cut fascia in order to relieve the pressure to get blood to circulate. And we have made it into the foot. We have intrinsic muscles here in the foot that are going to have both their proximal and distal attachments within the foot. And these muscles are going to help to support the arches and move the toes. So I just wanted you to take a look at the dorsal group of muscles that we have here. The dorsal surface of the foot, by the way, is if you are looking down at your feet, it's that top surface of your foot. So first we have your extensor hallucis brevis muscle. This is just going to extend the big toe once again, but it's only going to take place at that I always mess this up in the foot, metatarsophalangeal joint of the great toe. And then here you could see these muscle bellies here are going to belong to our extensor digitorum brevis, and these will cause extension of digits 2 through 4, and that takes place at the metatarsophalangeal joint and pip. Now the plantar group is going to belong to the plantar surface of the foot. So the surface of your foot that is touching the floor, that is where that is. And it's going to be supported by an aponeurosis that is formed by deep fascia. We are going to talk more about this in a clinical view in just a bit, but that aponeurosis extends between your phalanges of the toes and the calcaneus. So it has been cut here. It is called the plantar aponeurosis, but like I said, we'll take another view at this soon. The muscles in this plantar group are divided into 4 layers from superficial to deep. I am not going to hold you responsible for knowing these muscles and which layers they belong to, but they are all here. I will just scan through them really quick. Here's layer 1 where we have our flexor digitorum brevis, and you guys can figure out the actions just by its name. It's going to flex the digits 2 through 5. Then we also have our abductor hallucis muscle, which is going to abduct the big toe. And then we have our abductor digiti minimi, that is going to abduct our 5th toe. In our second layer, we have a quadratus plantae muscle, quadratus because it's square shaped over here, and our worm muscles, the lumbricals. And then our third layer over here, we have an adductor hallucis muscle, and I like to call this muscle lucky number 7 because it has 2 bellies over here that looks like a 7. And our flexor hallucis brevis, which also has 2 portions in here, and our flexor digiti minimi brevis. In our fourth layer, we're going to have our dorsal and plantar interossei, and here is a view of what that looks like. Here's our plantar interossei. We only have 3 of them, and our dorsal interossei, we have 4 of those. So here's our clinical view on plantar fasciitis. Here is your plantar aponeurosis. So it's in the center of your foot. And like we said, it goes from the phalanges of your toes down to your calcaneus bone. And so plantar fasciitis is going to take place when we have inflammation in this plantar aponeurosis. So if you're looking at your foot, right at the start of your heel is where that pain typically takes place. You can also see it pictured over here in red and down over here as well. And this is associated with an overexertion that stresses this fascia. So this may be because of ill-fitting shoes or being on your feet or not having proper arch support, and especially if you are on your feet a lot or do weight-bearing activities, have excessive body weight, or maybe you just have poor biomechanics, that can lead to plantar fasciitis. So more homeopathic ways you could take care of this is taking a tennis ball and kind of rolling it underneath your foot in order to try and release some of the tightness within this fascia that may be leading to the inflammation. But if you do have some type of tearing taking place, then you might need some other remedies, some physical therapy, and hopefully it doesn't lead to surgery.